Now, one of the drugs getting a lot of attention, especially over the last few months, is Remdesivir, which appears to help some COVID-19 patients recover much faster. The antiviral is only allowed for restricted emergency use and has been showing promising improvement for COVID-19 patients. It initially was used to treat people with Ebola. Well, Remdesivir is given through an IV, and it works by stopping the virus from growing or replicating. Officials with the NIH say patients who received Remdesivir had a 31% increased rate of recovery.
I didn't have a cough. I had a low-grade fever. It attacked my lungs so quickly, and from there, within 48 hours, I deteriorated.
This was at the beginning of the pandemic nationally. So did you even think that this could have been COVID, or because it was the beginning of the pandemic, did you think, oh no, maybe it's COVID?
You know, I really didn't think that it was COVID. I just was kind of feeling, I don't know, just kind of like the flu. But it wasn't anything that I couldn't handle. It's not like I had to be in bed, you know, and rest until, you know, I did go to the doctor, or to the emergency room in Austin. And
what took you to the emergency room, though, the first time? Because if I get a cold and not feeling really well, I'm not thinking to go to the emergency room.
I think it was probably because of the body aches. But I didn't have a cough. That's just it. That's why. But, you know, they gave out that number. They said you have to talk to the COVID nurse line number. So she asked me all the questions, and she's the one that said, yes, you need to go in. So actually, the hospital told me that I needed to come in. So they did everything. They took a CT scan, an X-ray, but...
Did you think that was excessive, a CT scan?
You know, I really didn't know. I thought, why are you doing this? You know, I didn't... I thought too.
So a little bit, you thought maybe this is a little much.
Yeah, and they were covering their bases.
Yeah.
But so then they sent me home, and if my symptoms worsened, I was supposed to call. So about, well, April 2nd, I was feeling so, at that time, fatigued. I didn't know what fatigue was until then they asked me, and I was like, oh, that's what fatigue is, because it was horrible. I mean, I couldn't sit still.
And this is like 2 days after you went to the emergency room?
4.
Okay.
About 4 days later. So it's progressing. And I called the nurse line again, and they said to come in.
But did they test you the first time in the emergency room? I mean, the nasal swab?
You know, now that I think about it, they did, but I didn't know that I had it yet, because the results didn't come back. It took a while for results. The second time, my husband had to have known it was bad, so he dropped me off. And like you said, that was the worst feeling, helpless feeling, is to watch you walk up the sidewalk and I couldn't be with you, and then not coming to pick you up. Things progressed so quickly, and my oxygen level was really low, so they had to put a mask on me. At that point, I called one of my sisters, just because she knew, she worked there at the clinic, or at the hospital, and she could see that it was bad and I was deteriorating. She said, you were breathing like a fish out of water, and you said some pretty powerful, strong words saying something terrible is happening to me and it's taking over my body. You need to pray for me. And that's not me. I mean, I'm a pretty private person, but I would never
say that,
you know, never say that. And I don't remember that. And at that point, I guess my oxygen levels got really low. They put me up on the medical surgery floor, and then I kept deteriorating, so they called my husband, and I was put in the ICU for 1 day in Austin, and then they called Rochester, and Rochester said she needs to be transported over to St. Mary's. So the next morning, they incubated me and put a tube in, and then I was transported by ambulance to St. Mary's ICU for 8 days, where I would spend 8 days on a ventilator.
I'm continuing my conversation that I sat down with recently with Shan Kehret, a woman from Austin who almost died from COVID-19. A lot of us are not as fearful as we were a couple of months ago. We've learned a lot in the last 4 weeks. But Shan's story is a good reminder as to why this was and still needs to be taken very seriously. When you first reached out to me, the first thing that grabbed my attention was that you were given about a 20% chance of surviving this. So this was as serious as it gets.
Yeah.
Walk me through what you've been told about that time, and then how you got better and where prayer came in.
This would be day 4. The doctors called my husband at 2 o'clock in the morning, and he got the phone call, and they said, we need you to sign this consent form. We just came out with an experimental drug, Remdesivir, and we would like to, it's a trial, clinical trial, and we want to put your wife on it.
I have to imagine, though, he was saying, how bad is it? What
So
did they tell him?
They said, and then he, of course, said, well, it's experimental. What are the side effects? You know, it could be enlarged liver, but after the treatment, she should be okay. But at this point, you really have no other choice. So that's when he knew it was bad. Like at 4:30 in the morning, started me on this trial, 10-day trial of Remdesivir. My breathing became still so shallow, and my blood pressure was really low because the COVID has now damaged my lungs. So the ventilator, they said, is breathing for you. I told my husband and said that the ventilator is now breathing for her because her lungs are so damaged. We have to let them rest. And this medication hopefully is going to help clear out this horrible virus that's attacking my lungs and my, you know, and your heart, because your heart isn't working properly. Okay, so at that point, that's when my daughter knew that it was bad too, and she didn't know what else to do. And we're very private people, so we don't do, but she said, I don't know what else I could do, Mom. So I just reached out to one of her friends and said, I need help, I need prayer. So her friend got the prayer page, Prayer Warriors for Shan, started, and within 24 hours, I totally did a turnaround, and I started to wiggle my toes and wiggle or squeeze their hands, and I could hear. And then the next day, so that would be day 8, was my husband's birthday, and 48 hours of the prayer chain, and I had over 900 people giving comments and praying for me. I woke up, and I just remember having this tube down my throat, or there's something in my mouth, because I couldn't talk, and they kind of told me what was going on, so I just kept going like this, telling them, and they're like, you know, you're hurt or you're in pain. I'm like, and I wanted it out. I wanted that tube out. And so luckily the doctor called Dayton and said they're cautiously optimistic about taking the tube out, but they're thinking about it because they don't want to have to re-incubate me. And at the end of his shift, he did remove the tube, and I could breathe on my own. And on Easter, April 12th, they said you get to graduate and you get to go down to the regular floor. So definitely an Easter miracle, and all those prayers, I know. I mean, I was in such great care being at Mayo and St. Mary's. Those doctors and nurses were, I mean, they didn't give up on me. They wrote a journal, so I have a journal the nurses wrote in there for me, which was very emotional. I didn't even know. I didn't read it till I got home.
One of the most severe cases of COVID-19 from somebody locally who we have heard from yet in this pandemic. So this half hour we are hearing from an Austin woman who nearly died from it. With no underlying health conditions, in her 50s and in good health, Shan Kehret and her entire family, husband and 3 kids, all got the virus. It was right around the beginning of April, but Shan's case was the most severe.
I had a hard time just wrapping my head around everything that happened from when I went into the emergency room in Austin and ended up in the ICU on a ventilator for 8 days.
What made you reach out to me? You're private, so sharing your story like this is anything but.
I feel like I have to let people know that, you know what, this COVID-19 is real, and it affects people differently. I mean, I've never smoked. I'm perfectly healthy. I'm in my mid-50s, so that's not supposed to happen.
But your family got it.
So
Isn't that something?
Yeah. How does a virus that powerful attack and, get into a whole family? I don't know.
Do you
And
feel that you were picked? Did the virus pick you? Did God allow this? Is it something that you try to rationalize in your brain like that?
and I do. Yeah. I was kind of thinking, how could this happen to us? Why did this happen? Why did it happen to me? Why did my daughter ended up, she got it too, and she was in the Austin hospital for 4 days. And she was pretty bad, and I didn't even know it until I woke up. And then asking, of course, the nurse right away, subconsciously, I think I knew because I was with her all the time. And I said, how is my daughter? And then she told me, and then I lost it. I mean, I just fell apart. They said that my husband and my boys had it, but they're fine. They were recovering at home. Yeah, they had mild symptoms.
So you can ask, why did you get so serious all you want? You may never have the answer to that. What do you believe is the reason? Are you seeing positives that have come out of it?
No, people have been so, when they see me, or they see me in this, which I don't go out very much, or they saw me at my daughter's store. I mean, they just want to come and give me a big hug too, and they're like, we're so glad that you're okay, and we prayed for you and your whole family, and you're a miracle that, you came out of this. So I am very humbled, and from the bottom of my heart, I thanked everyone. And yes, so do I question, and I say, why did I get this? Why did this happen to me? I guess you have to, now that I'm okay and I survived it, then I have to move on. But, and I wasn't ready. Obviously, I wasn't ready to be done on this earth. So yeah, maybe there's a reason so that I can tell my story and say, do I think that everyone should wear a mask and use a social distance? No, everybody, that's their preference. That's their right. They have a choice. Do I wear a mask? Yes, when I go into busy places. What I'm saying, and I'm trying to explain to everyone, is I wear a mask to protect you. I social distance to protect myself. So not to be offended if you're wearing a mask. I mean,
or not to be offended if you're not.
Yeah, right. It's just...
That's hard. Because I see people when they're not wearing masks, and I'm just like, come on. We're being told we're supposed to.
Well, right, and I don't know. And that was what I asked one of my doctors during my last dose of Remdesivir. He said, do you have any questions? And I said, I'm just scared to go back home, and can I be reinfected? Can I get this again? And he said, I wish I could tell you that. He said, chances of you being immune are pretty good, but he goes, I can't tell you that. You could get it again, and you might get it mild, but you also could get it again and hit it hard like I did, and I can't survive another hard hit.
In this last piece of my interview with Shan Kehret, a woman from Austin who survived COVID-19, she and I are talking about how this virus went from a terrifying yet unifying boat that we all found ourselves in. Then came the contentious and divisive battles of what drug would be used for treatment. Should we wear masks that experts can and can't agree on? Lockdowns, business closings, and so much more as we debate all of the fallout. But for Shan, politics and debates aside, she's just happy to have survived. What do you think of the politics that have come into this now? We were all in this together, the entire month of April almost, and now here we are, and it's become a political hot button.
I just know for myself and my family, I'm going to protect us as much as we can. Am I going to follow the guidelines? Yeah. I mean, doesn't mean everybody else has to. Nobody's forcing you to. But I tend to do so because I've been through it. I think until you've been through it, you don't know.
Right, and seeing, as I listened to your story and sitting there doing the news, I'm like, these are real people. I'm giving numbers of deaths every single day. I'm like, these are not numbers of deaths, these are people dying. I'm always so sensitive to that.
When I was in the hospital for those, well, 14 days, they told me, you know, try not to watch the news. That was one of the things I recommended. Don't watch the news.
I would have told you the same thing.
Do I believe that all those prayers that everyone was praying for me worked? Absolutely. Did all the other people that were in ICU on ventilators? Yes, but so it's a very emotional thing to try and absorb. I can't imagine my family for 8 days not knowing what was going to happen. I mean, I just, that bothers me too, but hey, I'm here, I'm strong.